Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of emergency medicine is altered mental status. Different topics which we will discuss in our today's lecture will be the terminology first. In this we will talk about some common terms used in relation to the altered mental status like dementia, delirium, stupor, coma, and what their meaning is. We will talk about them. Then we will discuss about some red flags which gives us the idea that the patient might have altered mental status and what are some contributing conditions that are the cause of the altered mental status. Then we will go over in detail about the physical examination of the patient with the altered mental status, and we will talk about the physical examination of the head, neck, then abdomen, and what are some findings we find in the physical examination in different organs or parts of the body. Then we will talk about the mental status assessment of the patient, in which we will talk in detail about the Glasgow coma scale of the patient with altered mental status. Then we will talk about the oculocephalic and oculovestibular test. We will talk about the caloric test and then the eye-opening test. All these tests we will talk and how we interpret these different tests according to the area which is involved in the injury. Then we will talk in detail about the differential diagnosis. Differential diagnoses are different conditions which leads to the altered mental status, and we will discuss them in detail, all the differential diagnoses which are present in the head, neck. Then we will talk about the differential diagnosis of the abdomen, heart, chest. So all these different conditions, we will discuss them in detail, which are associated with the altered mental status. Then once we will go over the differential diagnosis, that will give us the idea what are some conditions associated with altered mental status, and then that will really help us to know what are the different diagnostic tests which will be performed to evaluate the patient, like oxygen level, different toxins, and then alcohol level, complete blood counts, all these different tests, hematocrit levels. So we will talk about different diagnostic tests to find out the cause of the altered mental status. Then we will discuss the general treatment principles of the patient, and these general principles, treatment principles, depend mainly upon the differential diagnosis and the conditions which are associated with the altered mental status. If it's due to hypoglycemia, hyperglycemia, fixing those problems can fix the condition of the patient. So we will talk about the general treatment principles. So all these topics will be discussed in our today's lecture, and we will talk in detail about the conditions which can cause altered mental status. So besides this topic, we have other lectures on emergency medicine available on our website of sqadia.com. You can visit the website to look those lectures also. Thanks for watching sqadia.com.